I was going to say, I know how hard your job is, but the truth is, I really don't know how hard your job is because I don't experience your job. But I know that you work incredibly hard, and that's what helps us in the Bronx, the people in the Bronx. So I want to say thank you. Thank you to nurses, thank you to all the staff. You are doing God's work.
Buenos días, amigo, buenos días. Enfermera, nurse, enfermera del hospital Montefiore en una protesta increíble. Breaking news. Noticia de ahora mismo. Ahí lo tienen. Hoy es 23 de octubre 2025. Toda la enfermera del hospital Montefiore en protestas. Una protesta pasiva del Montefiore, enfermera. Ahí lo tienen. Montefiore Hospital, un hospital de los más grandes de aquí, del Bronx, y prestigioso.
And for many nurses, especially those who apply to families, who work hard now but they have the time and respect to do its process. We are asking for you to maintain changing messages for this service.
My name is Cameron Long, Content Director at Macon NYC, and we serve and organize the South Jersey community here in the Bronx. Our community are patients here. Our patients.
Good afternoon.
Huh?
How are you?
Oh, bien, ¿usted cómo
You
está?
can speak in Spanish, yeah.
No, yo hablo en
Okay,
español.
gracias.
¿Qué quiere que diga?
Algo de la protesta, de por qué se están protestando. Gracias.
Estamos aquí frente al hospital de Montefiore hoy haciendo una protesta demandando que la administración de este hospital venga a la mesa y hable con sus compañeras acerca de nuestra campaña para nuestro próximo contrato que tenemos con ellos.
Exacto.
Lo principalmente que estamos viendo son dos cosas: condiciones mejores para nosotros que estamos trabajando y segundo para los pacientes, que es más importante. Que tengamos suficientes enfermeros y enfermeras que tengan para cuidar a sus pacientes, que nos den un lugar donde podemos venir y seguramente proveer de ese cuidado que tanto queremos darle a nuestros pacientes aquí en el Bronx, como le merecen, en toda parte de la ciudad de Nueva York.
¿Cuántos hospitales son ustedes que tú sepas?
El hospital Montefiore tiene casi más de 5 hospitales, pero ahorita somos los 3 hospitales de Montefiore que estamos haciendo negociaciones aquí en Montes y en el lugar de
Where the place. ¿Y cuál es tu nombre?
Roxana García. Roxana García.
Muchas gracias por este minuto. Gracias.
From our executive committee.
Aren't this a wonderful group of national nurses?
I am so proud to be here. My name is Michelle Gonzalez from Montefiore Medical Center. I am a member of the National Executive Committee here at Montefiore, part of the negotiating team. As you have heard from our colleagues and our community members, this contract is important to us because we want to improve safe staffing for all of our patients. We want to improve the conditions for our patients by improving staffing ratios. Montefiore Medical Center is an institution that services the Bronx. The Bronx has a very diverse and beautiful population. Advocating for contractual language around ICE. Many in our community are immigrants from various countries. Every patient deserves competent and appropriate care. We most recently had the presence of ICE at one of our facilities. Nurses were pressured to discharge a patient who had just had a procedure. This, in normal circumstances, would have never been done. Our nurses, our staff have a responsibility to protect our patients.
That's right.
ICE is harassing the facility to discharge patients inappropriately. This is because we are seeing the beginnings of a fascist government take toward the ICE presence in our hospitals. The threat of ICE in hospitals poses a direct threat to community health and patient mortality. If patients are avoiding seeking care in efforts to protect themselves and families from risk of deportation, we can have an increase in infectious diseases and an increase in preventable deaths. No patient should have to deal with the threat of deportation when seeking health care. All New Yorkers deserve access to health care, and as nurses, we are saying, keep ICE out of our hospitals. Please stand with us as we fight to negotiate this language into our contract. Thank you.
Who's got the power? Union power. Who's got the power? We got the power. What kind of power? Union power.
Every patient
is a VIP.
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 Community, community.
Patients and community. Patients and community. Patients and community. Patients and community.
Every patient. Let me hear it. Every patient. Stay stopping.
Save lives.
Stay stopping.
Save lives.
Stay stopping.
Save lives.
They say cut back. We say fight back. They say cut back.
We say fight back.
They say cut back.
We say fight back.
They say cut back.
We say fight back.
They say cut back.
We say fight back.
They say cut back.
We say fight back.
Hey, hey.
Ho, ho.
Understaffing got to go.
Hey, hey. Ho, ho.
Understaffing got to go. Hey, hey. Ho, ho.
Understaffing got to go. Hey, hey. Ho, ho. Understaffing got to go.
The workers united will never be defeated. The workers
United will never be defeated.
The workers
United will never be defeated.
The workers
United will never be defeated.
The workers
Will never be defeated. The workers united will never be defeated.
Okay, so I'm going to turn it back over to Justina, our Cham 9 nurse.
What I said earlier, because a lot of my nurses weren't out here before.
Shout out Cham 9! Go Cham 9!
I'm sorry. My name is Justina Bandian-Sarazil, and I've been a nurse at Montefiore since January 2021. I work on a pediatric hematology oncology unit. Like so many of my colleagues, I know our patients deserve quality care, but we're not being given the resources to provide it. What we need is simple. Better staffing. Our patients deserve our full attention, our full care, but we're constantly forced to stretch ourselves thin. And that's not just hard on us, it's unsafe for them. One of the things that frustrates me about healthcare today is how often patients are reduced to numbers. Management talks in systems and data points. When we are working at the bedside for 12 hours a day, we're not worried about numbers. We're worried about our patients. We're worried about people. As nurses, we're going to do whatever we can for our patients. When a patient's condition changes during shift, we step up to support our team, whether that means shuffling assignments or taking on more patients. We're going to get it done. But it shouldn't have to be this way. We shouldn't have to make do because management refuses to staff us properly. They like to use phrases like, when staffing allows, but let's be honest, staffing never allows, not the way things are now. We're demanding patient-centered, safe staffing ratios. This isn't a luxury. It's basic, common sense care. When a patient has a crisis, we need to be there for them. But we can't do that at the expense of other patients. We need staffing commitments from Montefiore that allow us to support all patients with the level of care they deserve. Montefiore, do the right thing for your nurses and patients.
Montefiore Hospital en Protesta, amigos. En vivo.
Good afternoon, everyone. Thank you all for coming. We appreciate your support. My name is Leila Collins. I work at Montefiore Medical Center. I work in the Einstein Division on 11 North. It's a high acuity, fast-paced post-surgical unit at Guadalajara campus. It's a 30-bedded unit, and we have up to 4 hallways. And this is not only during the winter surge months. Nurses can no longer stay silent about the placement of patients in our hallways. It's undignified, disrespectful way to be treated when you're at your most vulnerable. We are speaking out because this practice is unsafe, it's unacceptable, and demeaning. I remember a particular situation where we had one of our young patients, she had a miscarriage. She was placed in the hallway and this patient was actively bleeding. It wasn't until, the alarm was raised, we had to get management involved. They took her to a more appropriate space to recover and breathe. No one should be treated like this. The reality is that patients who are deemed stable for hallway placement can deteriorate in an instant. We've had patients suffer medical emergency right there in the hallway, not only on my unit, not only in Einstein, but also at Montefiore right here. We've had to clear patients out of their rooms into the hallway and push our emergent patients into their spaces to get access to power for IV pumps, oxygen, or basic monitoring and privacy. Every minute we spend scrambling to relocate patients, it's time we should be spending saving lives. No one should be placed in a hallway once they've been admitted. Full stop. Every one of our patients deserves a room and a qualified nurse. We are here today because we have contractual proposals to find space in open rooms for all our patients. We want management to work with us to resolve this issue so patients can finally get out of the hallways. We're not really hearing anything much from them, but we're hearing is how much will it cost. Nurses want the absolute best for our community. They deserve it. Hallway care is not safe care. It's not respectful and it's not dignified. We owe our Bronx patients more than a draft-to-lift hallway with noise. We owe them safe and quality care. We won't stop fighting until we get it. Thank you.
So we had staff to deliver safe care without worry, without violence. The violence that isn't about us and other patients because of the frustration. And because we've been asking for so many years to stop the abysmal practice of hallway patients, to end ED overcrowding, to create a safe space for our patients to be treated with the dignity and the respect that they so rightly deserve, and for our direct caregivers to be able to be speaking about changes that need to be made instead of told what's going to happen, which is never the right thing. We know, we care, we know what our patients need. We know what we need to do to practice patients. We know what we need to do the right thing. Montefiore needs to start listening to us. the people who live here every day, work here every day, see the reality of what's going on. So I know that everybody's out here because they know that we can make it better. We know that Monty has money. Monty invests in White Plains Hospital and all the hospitals upstate, but they don't invest in our patients here in the Bronx. The legacy hospital, the beginning hospital of Montefiore. Our patients don't just deserve better, they deserve the best. Thank you.
Aquí tenemos una de las enfermeras de Montefiore, amigos, en vivo. Ella va a decir parte de las necesidades que siente el hospital y sus enfermeras. ¿Cuál es tu nombre?
Mi nombre es Yenaria Florian.
Yenaria Florian. Ahí está, ¿sí? Cualquier palabra que tú quieras decir.
Sí, claro, hoy estamos peleando por nuestros pacientes. La pelea de las enfermeras siempre es poner los pacientes primero para mejorar la ayuda que le damos dentro del hospital. Los hospitales pueden hacer mucho más, pero aquí estamos peleando para que ellos pongan de su parte. Le damos gracias a todo el mundo que vino aquí para apoyarnos también a nosotros.
Muchas gracias por esa palabra tan bonita. Buena suerte.
Same ratio. You know, the ratios is what we're fighting for. Good ratios, okay? Same staffing.
Y así terminamos este video, amigos. Montefiore Hospital Hospital de Nueva York. Las enfermeras están en protesta, mejor salario. Ahí lo dijeron ellas. Este es una de las partes del hospital Montefiore. Buenas tardes, este es en Breaking News. Noticia nueva acabada de salir. Bueno, amigos, buenas tardes. Con esto nos despedimos. Gracias por ver este video. Suscríbase para que vea más informaciones. Muchísimas gracias. Que la pasen bien.